Bismillahirrahmanirrahim. Quote of the day is yesterday I was clever, so I wanted to change the world. Today I am wise, so I am changing myself. Today my topic of presentation is Introduction to Epidemiology. My name is Dr. Amna Khalid, and I will be presenting the topic under the kind supervision of Professor Dr. Saira Afsar, who is Dean Institute of Public Health, Lahore. Starting the topic, we see a story behind every pattern. We ask some questions like why did COVID-19 spread rapidly in some countries but not in others? Similarly, why are dengue outbreaks concentrated in certain districts of Punjab? Why do smokers develop lung cancer more frequently than non-smokers? These questions actually represent the essence of epidemiology, so understanding the patterns of disease occurrence and identifying the factors responsible for those patterns. Moving to the history of epidemiology, this is a story of a Broad Street pump from London, 1854, which is related to a John Snow's investigation. When London suffered a repeated cholera outbreaks, and most people believe that cholera spread through bad air, but Snow suspected that it is the contaminated water instead which is causing this. So he mapped the cases by location and traced the source to the Broad Street pump. So why this whole story matters? Because Snow compared the cholera cases according to their location relative to the water pumps rather than relying on the assumption. So we conclude from this investigation that it demonstrated the disease occurrence follows patterns that can be studied scientifically. So this is the evolution of epidemiology uh, from Hippocrates, who said that a study disease influenced by environmental conditions. Then John Grant, who analyzed the mortality records and founded vital statistics. Then Edward Jenner, who demonstrated prevention through vaccination. Then John Snow, who applied the scientific investigation to outbreaks. And then in modern era, we apply these concepts of epidemiology to investigate chronic diseases, injury, mental, and environmental health. So, defining epidemiology, this is the study of the distribution and determinants of health related states or events in specified populations and the application of this study to the control of health problems. So, there are five major components of this definition. The first term is a study. So, this is a scientific discipline built on systematic observation and analysis. Then we have distribution, that is how disease varies according to person, place, and time. Then we have determinants, the causes and risk factors behind disease occurrence. Then we have the population, because epidemiology focuses on groups of people, not individual patients. Then its application, we're using the findings to improve health and prevent disease. So epidemiology is a way of thinking. It's not merely a subject. It is a questioning framework that guides every investigation. That who became ill, where did illness occur, when did it occur, why did it occur, and how can it be prevented. There are two ways of asking why. If this question is given to a clinician, he will ask, why did this patient develop tuberculosis? So clinical medicine focuses on the individual patient in front of the physician. But if epidemiologist asks the same question, he will ask the way that is tuberculosis more common in this community than another. So epidemiology focuses on populations and the patterns of diseases within them. So talking about the population health perspective, a population consists of people sharing common characteristics. The objective is to understand factors affecting the health at the population level. For example, we talk about the children under 5 years, pregnant women are another population, residents of Lahore are another focus, and industrial workers can also be studied. Then we have disease occurrence, which is not a random because some groups experience higher disease rates because of identifiable factors. These factors can be biological, environmental, behavioral, and social factors. So, role of epidemiology is to identify these factors. Distribution is the first pillar of epidemiology. The first task where we have to describe the disease occurrence, that who is affected, this is the person. Where does disease occur? This is the place. And when does disease occur? This is the time. So these three dimensions are known as person, place, and time characteristics. Person characteristics can be like age, because measles occur mainly in children. It can be sex, like cervical cancer affects women. It can be occupation, like silicosis affects the minors. It can be socioeconomic status as well, as malnutrition is more common among disadvantaged populations. Then we have the place characteristics, that disease occurrence varies according to the location, so helping identifying environmental and social influences as well. For example, dengue, this is concentrated in urban areas, malaria, which is concentrated in rural regions, and cholera occurs where sanitation is poor. Then we have time characteristics, like secular trends, long-term changes in disease occurrence over years or decades. Then we have seasonal trends. These are the regular annual variations, like dengue occurs more in monsoon season. Cyclic trends, like repeated fluctuations occurring over multiple years, and epidemics, which are sudden increases in disease occurrence above the expected level. So this diagram shows the person, place, and time framework that epidemiologists combine person, place, and time information to identify patterns and generate hypotheses for further investigation. Then we have determinants, which is the second pillar. Uh, Determinants are the factors that influence disease occurrence, like smoking, poor sanitation, air pollution, obesity, physical inactivity. These can be the different factors for different diseases. A risk factor is a characteristic associated with an increased likelihood of disease. For example, smoking can be a risk factor for lung cancer, HPV infection for cervical cancer, hypertension for stroke, and obesity for diabetes. Then we have the concept of cause. The cause can be necessary, sufficient, or component cause. A necessary cause must be present for disease to occur. For example, HPV must be there for cervical cancer to occur. Then sufficient cause can independently produce disease on its own. And component cause is the one which contributes as one element among many interacting causes. Then causes can be multifactorial as well. Most diseases result from multiple interacting causes. For example, cardiovascular diseases are the best among this example. That for the cardiovascular diseases, causes can be genetics, diet, smoking, physical inactivity, and hypertension. Then, as we talked about, we also have a concept of epidemiologic triad, where there is interaction of agent, environment, and the host. Agent is the factor causing the disease, environment are the external conditions which facilitate the disease, and host is the susceptible individual in which disease occurs. So if we take the example of malaria, then agent is Plasmodium parasite, host will be the human population, and environment will be the mosquito breeding sites and climate. So modifying any single component can interrupt disease transmission, and this is the basis of vector control programs. And then we divide epidemiology into the descriptive and analytical epidemiology. Descriptive epidemiology has the main purpose of simply describing the disease occurrence. And the questions which are answered in this portion of epidemiology are who is affected, where does the disease occur, and when the disease has occurred. So, this portion of epidemiology generates hypotheses for further study. While analytical epidemiology has the purpose of identifying the causes of disease. So the questions are that why the disease has occurred and how it can be prevented. So this type of epidemiology, which is analytic, this tests the hypothesis using comparison groups. So if we briefly make a comparison of descriptive and analytic epidemiology, the goal of a descriptive epidemiology is to describe disease occurrence, while analytic epidemiology identify the causes. Descriptive epidemiology answers the questions to who, where, and when, while analytic epidemiology answers to why and how. Descriptive epidemiology is observational. There are no comparison groups which are required, but analytic epidemiology has to use the comparison groups. Descriptive one generates the hypothesis, while analytic epidemiology tests the hypothesis. So this is the epidemiologic process. where we first of all we have to identify the problem. Then accordingly we collect the data, we analyze the patterns present in that data, and then we develop a hypothesis. Then we move to testing the hypothesis. Then we implement the interventions accordingly, and then we evaluate those outcomes from those interventions. So till now, we have been through this that there are five main W's which are answered in epidemiology: what, who, where, when, and why. These questions structure every epidemiologic investigation from outbreak response to chronic disease research. These are the major data sources in epidemiology. We can use the data from census, vital statistics, disease surveillance, registries, surveys, and research studies. So surveillance, which is the main function of epidemiology, which is the ongoing systematic collection, analysis, interpretation, and dissemination of health data. For example, there is ongoing surveillance of polio, tuberculosis, and COVID-19. These systems underpin the early detection and control of each. Then we have outbreak investigation in epidemiology. This is a brief preview. For example, the steps are: we confirm the outbreak, we verify the diagnosis, we define and identify the cases, describe them by person, place, and time, we develop the hypothesis, and then we make the control measures and then implement them. So, briefly summarizing the uses of epidemiology, we can have the community diagnosis, we can identify the risk factors, we study the natural history of diseases, we evaluate the interventions, and then we can plan the health services. There are different public health programs which use the main core of epidemiology, like vaccination programs, maternal health programs, nutrition interventions, and disease control initiatives. Epidemiology is also useful and used in the evidence-based medicine, like making the clinical guidelines. Population level evidence shapes the recommended care pathways. Then it helps in making the recommendations for screening as well, where we determine that who benefit from early detection programs. And then making the policies for treatment, where it informs that which interventions are adopted at scale. So the modern applications of epidemiology can be in the molecular epidemiology, genetic epidemiology, environmental epidemiology, digital epidemiology, AI and big data, wastewater surveillance, and so many others. There are different programs in Pakistan, like polio eradication, dengue surveillance, TB control, maternal mortality surveillance, and antimicrobial resistance monitoring, and so many others where we use the core of epidemiology. So why epidemiology matters? Here we summarize the whole thing. Uh, Through epidemiology, we understand the disease occurrence, we identify the causes, we predict the future trends, we design the interventions, we evaluate their effectiveness, and then we are able to improve the population health. So this is the whole summary of introduction to epidemiology, and we will go through the detail of each and everything in the coming classes, inshallah. So moving on to the MCQs. First question is, public health officer notices that most cholera cases in a town are clustered around one water source. She maps the cases and identifies a contaminated well as the likely source. Which epidemiologic principle is she primarily applying? Option A, disease screening. Option B, person, place, time analysis. C, randomization. D, blinding. And E, clinical diagnosis.
B.
B is the right answer. Question number 2. A physician asks why a 45-year-old man developed hypertension. An epidemiologist instead investigates why hypertension rates are increasing among urban adults in Lahore. This illustrates which key feature of epidemiology. Option A focuses on laboratory diagnosis. Option B focus on treatment outcomes. C population-based approach. D, individual patient management. And E, experimental design.
C.
Yes, C is the right answer. Question number three. Researchers find that dengue fever is most common among young adults in urban areas and during the monsoon season. The investigators are studying what? Option A, determinants of disease. Option B, disease prognosis. C, disease distribution. D, disease prevention. And E, disease treatment.
A.
They are actually working on the disease distribution. Question number four. A study finds that smokers have a much higher incidence of lung cancer than non-smokers. Smoking in this example is best described as option A, disease outcome, B, risk factor or determinant, C, disease frequency measure, D, population characteristic, and E, surveillance indicator.
Risk factor.
Yes, B is the right answer. Question number five. During a measles outbreak, health officials describe affected individuals according to age, sex, geographic location, and date of onset. This activity is an example of option A, experimental epidemiology, B, clinical medicine, C, descriptive epidemiology, D, screening, and E, intervention research.
Descriptive epidemiology.
Yes, right answer. Question number six. Following a dengue outbreak, investigators compare people who became ill with those who remained healthy to identify the factors associated with infection. This is an example of option A, descriptive epidemiology, B, analytic epidemiology, C, community diagnosis, D, surveillance, and E, vital statistics.
Analytical epidemiology.
Yes, B is the right answer. Question number seven. A malaria control program focuses on eliminating mosquito breeding sites around villages. The intervention primarily targets which component of the epidemiologic triad? Option A, host, B, agent, C, environment, D, reservoir, and E, vector immunity.
Environment.
Question number eight is, after identifying contaminated drinking water as the source of a typhoid outbreak, authorities repair the water supply system and chlorinate the water. Which component of the epidemiologic definition is illustrated? Option A, determinants, B, population, C, distribution, D, application to disease control, and E, frequency.
B.
Yes, D is the right answer. Question number nine. Health officials calculate that diabetes prevalence in a district has doubled over the last 10 years. The primary purpose of this activity is option A, community diagnosis, B, clinical treatment, C, laboratory investigation, D, randomized trial, and E, screening.
A.
Yes, it's the right answer. Question number 10. Our National Health Department continuously collects and analyzes weekly reports of tuberculosis cases from all districts. This activity is best described as option A, screening, B, surveillance, C, randomization, D, community trial, and E, case control study.
A.
B is the right answer, which is surveillance, because they are continuously collecting the data. So this is the answer key. This is the YouTube channel of IPH where this presentation will be uploaded. And thank you so much.
Thank you very much, Dr. Amna. This is a very nice presentation, and you have done a very good job in not only presenting but making the MCQs very clear and concise. And thank you very much, Dr. Kamran and Dr. Rabia, for your full participation. For next time, I would like Amna to please share this link in postgraduate group. Dr. Ali Arshad is the CR of our class of 2026 of MPH and MPhil students, and I have asked him to daily join this class presentations, and on Friday they will be physically present here, and on Saturday they would also be in our journal club. So as it is their zero semester, it means they are not given the registration number yet. After zero semester, on the feedback of the Dean Institute of Public Health, they would be allocated their registration number, and then they would be the official students of Institute of Public Health. As they are having their zero semester, so they are also allowed to join the online classes as well as journal club and physical classes in Institute of Public Health. So these are my few words. Thank you very much, everyone.
Thank you so much, man.
Thank you.